Hi, my name is Joseph Cador, and this is my persuasive speech. The title, Medical Marijuana. Does it really help? For a lot of Americans, the use of medical marijuana is a subject they feel very passionate about and continue to be strong advocates for its use. But for others who just hear about medical marijuana and have no other ties to this subject, I would like to give you a chance to be enlightened today. No pun intended. If you had cancer, glaucoma, AIDS, or any other debilitating disease, and knew of a drug from which would give you immediate relief, would you seek it out? If your mother was suffering, your wife, would you want to offer them some relief for their symptoms? Medical marijuana is the answer to these questions. Let me explain. I would like to explain how medical marijuana can help people with certain ailments overcome symptoms regarding their specific ailments, further supporting marijuana for medical uses. I chose this topic because in this present day, the education of how marijuana helps millions of people suffering from certain diseases is the key to better understanding what's really at stake with legalizing medical marijuana. I will discuss certain diseases such as AIDS, cancer, glaucoma, and how medical marijuana helps relieve symptoms from these diseases. I will discuss a certain portion of the country and how many people are affected from these diseases, and then I'm going to discuss how the government plans to control this drug in its process to make it legal. Many people across the United States suffer from many diseases that marijuana can absolutely help in relieving of certain symptoms associated with these diseases. AIDS, also known as acquired immune deficiency syndrome, is a disease that is characterized by a major weakening of the immune system, according to procon.org. In patients that have AIDS, they often have wasting symptoms that cause their body to experience nausea and loss of appetite. Yet when marijuana is used in these patients, they report less nausea and also increased appetite, which helps with the problematic symptoms of waste. Also, these patients experience pain throughout their bodies due to organ dysfunction, and the marijuana has reportedly helped with relieving this pain, according to the Institute of Medicine. Cancer patients across the U.S. undergo many treatments to abolish the cancer in their body, from radiation due to drugs, and both of these treatments cause these patients to experience nausea and vomiting, which can also keep the patients from receiving proper nutrition from their food, which is essential in getting better. THC, which is a specific drug found in marijuana, has been shown through studies of people who use marijuana to help with pain associated from radiation and dramatically improve their appetite. Furthermore, researchers from California Pacific Medical Center have shown that cannabinoids could slow the growth of aggressive human breast cancer cells and aggressive brain tumors. Glaucoma, which is a disease of which the eyes of a person feels great pressure in their eyeballs and they eventually lose sight. Marijuana can help relieve this because it has properties that greatly reduce this pressure. Marijuana also helps with anxiety a person feels who has glaucoma, because a lot of times they'll feel this anxiety due to losing their own eyesight. There are so many diseases that might affect people in your own city or neighborhood, but since I have been focusing on AIDS, cancer, and glaucoma, I'm going to tell you about how many people are affected in my own area. After speaking to a friend in the state of Massachusetts who is beginning the process for opening up a dispensary for medical marijuana, I was able to come up with some important figures for the state of Massachusetts for people affected by AIDS, cancer, and glaucoma. So let's start with AIDS. In the state of Massachusetts, there are 22,014 people who are affected by the AIDS syndrome. In my friend's specific city where he lives, there are 1,832 people who have AIDS. As far as cancer patients in the state of Massachusetts account for 38,470 people. And in his specific city, there are 7,509 people who have cancer. In the U.S., in Massachusetts, as far as glaucoma is concerned, there is 65,875 people who are affected by glaucoma. And in my friend's specific city, there are 7,509 people who suffer from glaucoma. With all this information and proof of marijuana helping these people, the next step is legalizing this. And we need to look at what the government plans to implement to safeguard the safe dispensing and the use of marijuana. First of all, the control of medical marijuana is simple and should not be confused with efforts to legalize marijuana for recreational use. Those two issues are completely and absolutely separate. Only states that have legalized the medical use of marijuana can receive this drug. Only doctors that have authorization to prescribe this drug can do so. Marijuana can be dispensed from marijuana dispensaries sanctioned by the federal government to grow and dispense it. This circumstance that allows dispensaries to dispense marijuana to those that have been prescribed it by a doctor lessen the means by which people who need it will not seek out illicit drug dealers, which brings crime down. The fact that these people can obtain it legally does greatly reduce crime in drug-related crimes. Emergency room doctors have found that many cases involving abuse of marijuana or ill effects from marijuana result in illicit drug dealers often lacing their marijuana with some other drug to make it more potent for their buyers, so their buyers will come back time and time again. Having this legalized through medical marijuana will greatly reduce that. Dispensaries can safeguard this because they are only sanctioned by the government to grow and sell certain strains of the plant that is safe and have a safe amount of chemical makeup that is needed for the patients. The government does regular safety walkthrough inspections and checklists to ensure that these dispensaries are abiding by the law to dispense marijuana. In conclusion, today I have offered up many valuable insights and education into how marijuana or medical marijuana can be safe can be life-saving drug to help those in your community, your friends, and possibly even your family members live more comfortably with their disease. It's important as a responsible citizen in our community to know precisely what laws will affect us and those in need of our help, so I hope that I have assisted in enlightening you to the medical uses of marijuana. Just remember, if somebody you love dearly was suffering from a disease and the government told you that one of the few drugs that can alleviate your loved one's symptoms was not allowed to be given to them, would you just let them suffer, or would you do something about it? The education is now yours, and you hold a vote in this democracy. Use it. Did not show you. Good.